Hello, everybody. We're just so thrilled to be joining and here with you today for the Great American Smokeout. As those of you around the country and even hopefully places across the world are coming together, supporting one another and quitting smoking. Such an incredibly privileged to be with you as we are all in this effort together. And today we're going to talk about different projects and ways JSI has learned to help you succeed in your quit attempts. And if you're a healthcare provider or other support person working with youth or older adults, things that are really help be successful in quitting tobacco products. So I'm Terry Greene, an environmental health specialist with JSI Research and Training, or JSI. And I'm here with my colleagues, Wendy Chow. And Wendy, maybe you would like to introduce yourself?
Yes. Hi, everyone. I'm so happy to join today. I work with Terry on a couple of projects related to asthma and smoking, and we look forward to talking with you today about some of those.
That's grand. And also Christin D'Ovidio.
Hi, I'm Christin D'Ovidio, and I'm here to talk about youth vaping prevention. Thank you.
Wonderful. Well, great to have you with us, Christin. And stay with us. We're going to be talking with you afterwards, after Wendy and I discuss some of our work with asthma. So asthma and smoking clearly is related, connected. About 1 in 5 U.S. adults who have asthma smoke cigarettes. And about 9% of adults who are sent to the emergency department, who have an emergency department visit, that attack is related to smoking. So very important to address asthma and smoking together. Also for children, about half of children, 54%, who have asthma are exposed to secondhand smoke from others in their home. So quitting is a way of caring for yourself and caring for your loved ones. Smoking hurts those closest to you, literally. And so it's a great reason to quit today. So excited for you and all of us in that these attempts to quit together. And it can be hard to quit smoking. Most smokers do want to quit, and it may take more than one try. So know that if your first try doesn't succeed, to keep learning from it, keep trying again, and also get support. There's a lot of support out there, including from your healthcare provider, and from hotlines and free resources such as 1-800-QUIT-NOW, QUIT now, NOW, a hotline that you can call nationally to find out what resources can help you in smoking, because it's better not to go it alone. More than half of smokers will try to quit in any year, and even if it takes those multiple attempts, you eventually can certainly succeed, and your chances are much better with the support from providers. JSI works to help people connect with their healthcare teams, providers, to get that support. And what we'll talk about today includes a model used in the Reducing Older Adult Asthma Disparities initiative. And that includes home visits and team supports. This was launched by the Massachusetts Department of Public Health Asthma and Prevention and Control Program, working with Lowell Community Health Center. And so, Wendy, could you tell us a bit more about the ROAD study and how that approach works?
Sure, yes, I certainly can. So ROAD is a home visiting program that connects the clinicians in the health clinic with patients with asthma and their families. So a community health worker visits these homes to show patients and their families how to reduce exposure to tobacco smoke and other environmental triggers that can cause asthma attacks. So this is to protect people with asthma, patients with asthma, or if they have COPD or cardiopulmonary disease. So the community health worker is connected to a clinical team, and they help refer patients and their family members to smoking cessation services such as the hotline 1-800-QUIT-NOW that Terry mentioned earlier, if the patient is a smoker or their family members are smokers.
Wendy, could you say more about that, about the role of family members?
Yes, sure.
Yeah.
So quitting smoking is hard, as Terry said. It may take many attempts and tries, and there may be failed attempts, but you just have to try again. So having having your family members support you and motivate you in quitting smoking is very important. If, on the other hand, someone else in the home smokes, and the secondhand exposure can be a trigger as well for asthma symptoms. What's more is that smoke can linger inside the home on surfaces, for example, on your couch, on furniture, and on the walls. And this type of smoke is very hard to get rid of. It's the chemical residues. All of this can make asthma worse for people who have this condition. So,
Right. So it's important. I know some people think if you are a smoker, that you can protect your family by opening the window when you smoke, whether it's in your home or if it's in a car, rolling down the window. We're learning that that's not enough. It's not quite enough, because the smoke both comes back in with the toxic chemicals that it has and the particles, the smoke itself that's irritating and creating asthma attacks and other health problems. And as you said, so that's the secondary smoke is what you're breathing, but then it also, like you said, Wendy, is staying on surfaces like walls and furniture, the car upholstery, or even your clothing. And so it's really important, if you are quitting today and are trying to support your family, that when you do so, if you're still using tobacco products, that you make sure to only use them outside and, not inside in the home or in the car. So the approach you're talking Road is promising. Can you just say more about what we're doing?
Yes. So we did find very promising results from our study. The patients who participated reported having better symptom control. So fewer asthma symptoms. They also were able to do things that they weren't able to do before. So exercising, and there's no shortness of breath. So just improved quality of life, generally speaking. And these benefits also apply to folks who had COPD. And we saw fewer hospitalizations as well as fewer urgent care visits.
And that's just so exciting, especially too. I was surprised the COPD, we weren't even expecting to be able to move the needle on that. It's a disease often caused by smoking, very hard to improve people's symptoms and well-being, and yet addressing the trigger factors that we know for asthma also was helping with COPD, and smoking certainly most among those. So asthma can be better managed and even be prevented, as can COPD. And equity is central important as we're advancing asthma-related smoking cessation initiatives. When you mentioned a community health worker who visits the home, that's a person, a CHW, hired because they are connected to their communities, speak the language, share culture. In the Road study, we had Cambodian, African immigrants, people Spanish-speaking, community health workers, and they were trusted by clients, which is a great way to build a relationship between a healthcare team and the patients, to both be understood and trusted by the clients, and also to respect those clients and learn what they have to share with healthcare teams. So with that, schools are another important environment besides homes that our partners are working with, and school nurses, and including referrals to smoking cessation programs for families of youth with asthma. Our next speaker is going to talk more about working with youth. And thank you, Wendy, for joining us. And to learn more about the Road study and other asthma and tobacco initiatives, visit jsi.com. And now we're going to discuss reducing the impact of tobacco through youth vaping prevention and cessation from JSI College Christin D'Ovidio.
Hi. Thank you. So yes, I'm here to talk about, so the Great American Smokeout is really a day for people to come together and make a decision to quit tobacco use of any kind. And that includes youth, of course, because there are youth and young adults who use tobacco products. So at JSI, we worked with the state of New Hampshire to address the increasing prevalence of vaping amongst youth nationally, but also specifically in New Hampshire. So if anyone listening doesn't know what a vape is or an electronic nicotine delivery system is, they're a non-combustible product, and you've probably seen many of them at gas stations or advertised on the internet. And they were specifically advertised by a number of companies towards youth. But they have varying levels of nicotine, and they are addictive and dangerous. So our campaign that we created through research was called Save Your Breath. And it really addressed the reasons that we heard from youth about why, one, they didn't want to use the product, or if they did, why they wanted to quit. And those reasons really had to do with short-term health effects, not longer-term, and effects to them physically and how they appeared and their appearance to others and acceptability around use of the product. So prevalence of high school youth use of vaping, ever use, was almost at 50%. That's in the 29 youth risk behavior survey data. When we did an independent study at the New Hampshire level, we found that the rate that was self-reported from those youth that participated in the survey was even higher. So really, vaping doesn't just harm mental health by increasing anxiety and withdrawal. And a lot of times we're hearing from youth that the reason they kept going back to the product was to try and deal with issues around anxiety or depression. Some other reasons we heard from youth were that they might be dealing with feelings of sadness or loneliness, potentially living in a home with someone that they thought might have a substance use disorder. And so all of these things can impact youth through their day, and they still came forward with these encouraging words to each other about quitting, and feeling empowered that they could quit. And so in New Hampshire and in many states, there are resources available, not just for adults, but also for youth, and specifically to quit vaping. And there are some national resources as well. And a lot of times they use a text to quit service. So I guess all this is to say that even though vaping companies are targeting youth and they're designing their products to hook youth by using flavors like cotton candy or bubble gum, and they are trying to cast a perception that this is not a tobacco product and that it's harmless, but that youth are really open to seeing the lie that these companies are trying to sell to them, and they're empowered. And so they're taking back their health and they are quitting. So for anyone, there is a free hotline that you can call in any state. It's 1-800-QUIT-NOW. And that line routes you to your own state's cessation services. And online, of course, through a search, you can find some of the national resources to help with quitting vaping specifically, a lot of text to quit services. And if you're interested in learning more about the project, you can visit health communication at jsi.com.
Thank you all. Thank you, Christin. Thank you, Wendy. Good luck.
Thanks, you guys too. Good luck to everyone quitting.